Hello everyone, you're welcome to the second episode of Health Checks with Dr. Memstic. And today we'll be continuing from where we stopped at the last episode. The last episode we talked about prostate cancer in male and the risk factors for prostate cancer in males. So today we'll be talking about the signs and the symptoms and the screening test you need to do to look out for prostate disease as a man. So the signs and the symptoms. 1. If you notice that you urinate frequently, as a man, you urinate frequently, and even at night, you wake up more than 2-3 times to urinate a lot. There are other causes of increased frequency of urination, like maybe diabetes mellitus. If that has been ruled out, you're not diabetic, and you're still having urinary frequency increased in the number of times you urinate, particularly at night, is a pointer to the fact that you may be having a problem with your prostate and you need to get your prostate checked by a doctor. The second one is what we call urgency. You're fine, you're okay, and then suddenly you have the urge to pee, to urinate. And then you're now under pressure. Before you even get to the toilet or where you can empty yourself, you find out that you're losing control and you're already peeing on yourself. That's the sense of urgency. It means there's something. There are other causes. Even a urinary tract infection can cause that. But if you have that persistently, you've ruled out other causes and you're still experiencing it, it may be pointing to a fact that you have a problem with your prostate. Another symptom is what we call hesitancy. You now want to pee. You have gone to the toilet. You've brought out your stuff. You want to pee. And then the pee is taking a while to come out. It's not coming out like you want to pee. Oh yeah, pee. There's some hesitancy. You have to wait a little for the urine to flow. It's not normal. It shows that there may be a problem with your prostate. Look out for it. Another symptom is with your urinary flow. You have a weak flow of urine. As children, if a boy wants to pee now, you see the long stream. It can start from here and reach there. But as you grow older, that reduces. But if you notice that your urine is trickling, it's not coming out well, or it's coming out, then it stops, it's trickling, it's a sign that you may be having problems with your prostate. Don't keep quiet. Don't ignore it. Seek for help. Another symptom is post-urinary dribbling. You finish urinating, and then you're still having urine trickle coming out. It's a sign of a problem with your prostate. Please don't ignore it. Look for help. Cry out for help. Another symptom is maybe pain while urinating. You feel pain as you're urinating. Yeah, we know that sexually transmitted infections, UTI, urinary tract infections may cause that. If you have done everything, treated yourself, and then you're still having pain while urinating, it's a pointer. Please don't ignore it. Seek for help. Another symptom is back pain, persistent back pain. If you've ruled out all the other causes of back pain, and you're still having this persistent back pain, it's a pointer to a fact that you may be having a prostatic disorder, a prostate disease, or a prostate cancer. So those are the signs, some of the signs you should look out for. If you are experiencing any of this, please don't keep quiet. And people start experiencing prostate problems from the age of 45. If you have a family history, like I said in my last episode, if there is a family history, a first-degree relative, that's your parents, your father, or you have a brother, someone who has suffered a prostate cancer, a prostate disease, you are more at chance. So you need to look out. Watch out for these signs and symptoms. Do not ignore them. Thank goodness, as with every cancer, early detection is key. Cancer can be successfully managed. They say prevention is better than cure. If you pick it at an early stage, you look out for these symptoms, and especially if you know you have a family history. Once you notice any sign or symptom in your body, please cry out for help. Go to the right channel. Do not go to the quack or go to the chemist or the pharmacy with your symptoms and complaints. Get to the nearest facility. Look for a doctor. Even a urologist is a specialist who deals in, disease of the urinary tract and all that. So seek for care at the proper channel. If you have cancer, it can be treated if picked at an early stage. So what is the screening test that is recommended for men from 40 years or 45 and above. Once you are 40 years, it is important you have a prostate-specific antigen test done. As a man, please, from 45 years, if you have a family history, once you clock 40, get to a lab or go to the hospital and say you want to get your prostate checked. That is the screening test that will let us know if you have prostate cancer, or if the values are going high, it means that it's pointing to the fact that, you know, there's something wrong with your prostate. So every man, the take home from this episode is that every man from the age of 40, or preferably 45 if you do not have a family history, should go to the lab or go to the hospital and have a PSA done. It's a blood test, and depending on the value, we would be able to know if it's still at the early stage. There are interventions that can be carried out to prevent you from developing full-blown prostate cancer. Ignorance is no longer bliss. That is why Health Checks with Dr. Memstic is here to provide you and furnish you with information. So don't say as a woman, this doesn't concern me. I believe you have brothers, you have a husband, you have sons, you have friends who need to be informed. And we implore you to subscribe to this channel, like, share, tell a friend, share it, and ensure that everybody is aware. Do the necessary screening that you have to do. And based on the result of that screening test, other interventions will be provided. Cancer is only a threat when it's at the late stage, where we can do little or nothing to save your life, and it has spread. Because cancer doesn't just affect the organ where it started. It goes ahead to affect different parts of your body. By the time you're now having weight loss, you know, you're coughing, you're having back pain and all that, is a sign that cancer has spread and affected other parts of your body. Stay informed. Get to a health facility. Subscribe to this channel. I am open to answering your questions. Drop your comments, drop your questions, and we'll see you again on the next episode of Health Checks with Dr. Memstic.